What is the role of Pentacam in ophthalmology and anterior imaging? This is Lorcan Butler from the IVs podcast from iNews.
Thanks to the sponsors of the show, Mainline Instruments. They provide unmatched service and unbeatable products in eye care technology. But just a reminder, this podcast is editorially independent.
I'm delighted today to be joined by ophthalmologist Dr. Lucia Pelosini. Dr. Pelosini, would you be able to explain to our listeners who you are, where you're working, and what your interests are, please?
Hello, Lorcan. Hi. Thank you very much for inviting me. So I'm a consultant ophthalmologist. I work at King's College Hospital in London. I work in a busy cornea anterior segment service, and we use the Pentacam daily. The Pentacam scan is always on. The technicians taking Pentacam images are always very busy. There is a long queue. When we started using Pentacam many years ago, the Pentacam was a diagnostic device dedicated mostly to cornea anterior topography. But now the Pentacam is used for the full examination of the anterior segment. We start from the ocular surface, we examine the cornea, we use Pentacam in glaucoma patient to examine the anterior segment, the anterior chamber. We use Pentacam before and after cataract surgery. More and more we see patients with previous history of refractive surgery. They had refractive surgery 20 years ago. They now present with cataract. The Pentacam is an essential tool in most of our anterior segment patients. A very large proportion of my patients present with corneal disease. They're young with keratoconus or older patients with corneal dystrophy. And again, the Pentacam is always at the center of the diagnostic platform for us.
It must be fantastic just to have one piece of equipment that gives you all the information.
Absolutely. So I always remind the juniors, Pentacam means that we can achieve 5 different diagnostic properties. We can use it as a topographer and tomographer. We can use it as a biometry device. We can use it to measure refraction and aberrometry. And now with the new softwares, we can also use it for retroillumination. So we can definitely do many things. We can assess patients just presenting for the first time to us as a screening tool. So the screening platform of the Pentacam is very important. And additionally, but not least as important, is the educational value of the Pentacam for patients. It's extremely helpful in a busy clinic to be able to show a picture to a patient, to explain a pathology, to explain a clinical decision based on a picture. And it saves time for us and it's very engaging for patients. Many patients say, for the first time, now I've got an understanding of what the problem is. Many patients want to take a screenshot of their own anatomical picture or topography map because they say, if I take a picture, I can show it to my relatives. I can explain what I've got. I now understand it.
Can we just concentrate on the corneal ectasias, keratoconus, and we'll just start with maybe at the anterior surface and work our way through to the anterior chamber, into the lens. So looking at the corneal ectasias, you've mentioned keratoconus. Is there anything else that you're looking at? Anything you can detect?
Absolutely. So keratoconus is one disease in the spectrum of ectasia of the cornea. We may see patients with starting from the simplest irregular astigmatism. Many teenagers, children are referred simply because they go for the first time to an optician. They are found to have a high astigmatism. And we can only, once we have a Pentacam topography map and we can assess the anterior and posterior surface of the cornea, we can only have confidence to say, look, you just have a normal astigmatism. You just need glasses. This is extremely reassuring. We don't need anything else. We have the diagnosis. We have patients in young age presenting with irregular astigmatism, and we detect early stages of keratoconus. Extremely important now that we can offer collagen cross-linking to slow down the progression of the disease, but also other interventions like cornea rings before we get to the end stage of the pathology, which may require a cornea transplant. We use the Pentacam and the cornea topography and tomography images to assess the densitometry of the cornea. So the densitometry evaluation is very important even in patients with dystrophy, the most common being the posterior endothelial dystrophy. Patients with Fuchs disease are very commonly presenting with early stages of cataract. And the Pentacam and the analysis of the densitometry of the cornea is very helpful for the clinician to understand the proportion of the visual function that is impacted by the corneal abnormalities and how much is impacted by the lens cloudiness or changes. And it's also very helpful to decide whether we can just proceed with a normal cataract surgery and observe the cornea, whether we need to plan a combined phaco DMEC surgery with endothelial transplant. So there are many, many different applications that help in any level of clinical decisions, from the first screening when we see a patient for the first time to when we get to the stage of deciding surgical treatment.
And what's the importance of looking at the posterior corneal surface and also the implications it may have on your treatment?
It's critically important, and we know that we need to consider the posterior surface of the cornea and the posterior curvature for many things, not just for assessing the health of a cornea before refractive surgery, but also in the calculation for IOL. So for planning lens surgery, whether we're treating a patient with cataract or whether we're doing a refractive lens exchange or whether we're going to do a phaco for presbyopic correction. So the concept of cataract surgery is now changing. When we take the opportunity to remove a cataract, we want to correct the refractive status of the patient. The assessment of the posterior cornea is extremely important to have the true definition of the cornea refractive power. So we need to move away from assessing just the surface of the cornea with the keratometry reading, limiting the measurements to the anterior cornea surface, and then extrapolating a possible posterior curvature without measuring it, to actually use devices that can measure the posterior cornea surface and can work on the lens prediction starting from a cornea power measurement rather than the anterior keratometry. So the assessment of the posterior surface is extremely important, even starting from the most routine monofocal toric lens for a routine cataract surgery. It is essential to measure the posterior cornea surface in order to calculate reliably the power of a toric lens.
And also, the Pentacam is able to measure the corneal surface without the presence of the tear film. How important is that?
So in ophthalmology, many devices are based on reflection and assessment of the anterior cornea surface, and obviously they are affected by artifacts caused by an irregular tear film. One of the main advantages of Pentacam is also that because it is based on Scheimpflug technology and imaging, is less dependent on the quality of the tear film and the quality of the ocular surface. So the Scheimpflug camera takes 25 images it's a rotating camera, does not rely on reflection on the anterior cornea surface, and therefore is less affected by an uneven or bad or irregular tear film. Of course, when we have a patient with an irregular tear film with dry eye, this patient will be less cooperative, will be less able to fixate a target, will be less able to see a clear target or following the direction of the technician. So improving the ocular surface is still very important, and many times when we are preparing a patient for surgery, it's very good to just treat the ocular surface first and then take reliable measurements. But the Pentacam can take reliable images without having an optimal tear film.
And that should make the patient experience an awful lot more better, shouldn't it? Rather than kind of going back for dry eye treatment and drops and compresses and possible steroids for any inflammation, that you can just avoid the tear film altogether and give you a totally clear picture of the anterior and posterior corneal surfaces.
Absolutely. From a logistic point of view, we know that we are constantly in very busy clinic, and we don't want to keep a patient for a long time in each diagnostic test. The Pentacam can take 5 different diagnostic assessments in a very short time. So definitely the patient having a Pentacam scan will be much more cooperative. The scans will be much more reliable. They're taking in less time for a technician. So extremely important to have the measurements being independent or less affected by the ocular surface.
If we could move now into the central corneal thickness and the use of pachymetry by the Pentacam, can you explain to me the importance of that in your glaucoma assessments and IOP measurements?
We know for a long time that the measurements of the intraocular pressures are affected by the pachymetric measurements. The Pentacam device offers the ability to correct the intraocular pressure measurement with a correcting factor based on pachymetry. So the advantage of taking a pachymetry assessment with the Pentacam, first of all, is that we take multiple measurements. We measure the central cornea, the paracentral cornea, the peripheral cornea. We have access to the thinnest point of the cornea, and then the Pentacam will also give us a correcting factor to apply on the intraocular pressure measurement. So another advantage that covers many of the applications of the Pentacam is that the Pentacam not only offers the technician or the clinician with an anatomical picture or with a diagram with measurements, axial length measurement, but very often the Pentacam is giving us a measurement and also a diagnostic or a helpful suggestion to apply immediately on our clinical decision. And one of this is the correcting factor for the intraocular pressure.
If we now move into the anterior chamber, can you talk about the features that the Pentacam has for 3D anterior chamber angle assessment and what that means to you on a day-to-day basis?
The assessment of the anterior chamber with the Pentacam is a very important application. We assess the anterior chamber from 25 different directions with 25 different pictures. We have a 3D reconstruction of the anterior chamber, and the Pentacam offers objective measurements of the depth, the angle depth, the anterior chamber depth. So these are measurements that the clinician can apply to the assessment of a glaucoma patient, the assessment of the position of a pressure flow tube or any drainage tube, but also in a preoperative assessment if we are planning a phakic IOL for correcting a high refractive error. So the assessment of the anterior chamber, 360 degrees, offering the view of the angle as well as the central part of the anterior chamber from the endothelium to the anterior lens surface, has many applications, post-surgery and pre-surgery in the assessment for the patient.
It can also possibly help too with your hyperopic patients in showing a shallow anterior chamber depth and the implications that may have in your intraocular lens calculation or if the person is suitable for surgery.
Absolutely. So the assessment of the anterior chamber measurement has different possible applications. We can use it every day to assess patients before cataract surgery, to assess the risk or the possible difficulties of the surgery. We can use it in the assessment of a glaucoma patient with objective measurement of the angle depth or the presence of drainage devices. We can also use it preoperatively when we're planning phakic IOL implants in the posterior chamber, for example, for refractive purposes.
And do you find you're detecting more now anterior chamber disorders with the introduction of the Pentacam?
So the Pentacam can be used for the assessment of the anterior chamber, not only the angle or the depth of the chamber, but also the anatomical structures like the iris. So sometimes we have incidental findings where we may see an elevated lesion on the iris, and having an objective measurement is a very important tool for following up this patient over time and comparing serial measurements.
And if we move further now into the crystalline lens and looking at the lens shape, lens size, cortical opacity, central opacities, can you explain to our listeners the importance of what Pentacam gives you there?
So another important application is the examination of the crystalline lens and the assessment of the densitometry of the lens. So there is a particular function of the Pentacam, which is the grading system for nuclear sclerosis. Obviously, when we are examining a patient before surgery, we would like to have an idea of how difficult the surgery could be in a big department like a tertiary hospital where we have different grades of surgeon doing theatre list. It's very important to assess the risk of surgery preoperatively in order to assign cases to specific surgeons of different levels. So the assessment of the nuclear sclerosis, the grading system, will give us a predicting expectation on how hard could be the nucleus, the settings on the phaco. So there are studies and very interesting publications relating the densitometry of the lens with phaco settings in order to be able to predict and maybe plan the surgery in advance, depending on the at the stage of the cataract.
And is this just used in your hospital, or is it used in other trusts as well? Is the kind of the grading system quite a uniform system that's easily accepted and easily adopted, or is it just used in your hospital?
So the grading system of nuclear sclerosis is not something that is used day to day in the routine cataract surgery setting, but it's an important tool. So if we want to assess the possible severity or difficulty, surgical difficulties of a cataract, having the densitometry or seeing the distribution of the opacity on the densitometry diagram is extremely interesting. If we have a patient where we don't know whether planning cataract surgery is the right decision at the correct time, having a look at the densitometry may actually confirm whether the patient's symptoms are caused by the lens. So having an imaging and an objective measurement of the scatter caused by the lens helps the clinician to understand and correlate the patient's symptoms, which are subjective, descriptive symptoms, with something more objective that we always like to have in the examination.
Do you ever find that something comes up on the Pentacam with the crystalline lens densitometry which doesn't actually release when you actually perform the procedure? Does it get it correct 100% of the time, or there are sometimes you get a few surprises?
Well, I'm sure as in any imaging device, the clinical examination has to be correlated with the imaging that we have. We always need to be aware of possible artifacts, possible reflections. If there is an opacity in the cornea, in the central cornea, that may have an effect on how the lens scatter is examined. We need to remember that the Pentacam examines the cornea with a rotating camera, but still having corneal opacities. For example, if we think at a patient with hepatic cornea scars, we may have less signal or less reliable signal analyzing the densitometry of the lens intraocularly.
And it must be so important too, as well, when you have patients who've had previous refractive surgery, and maybe the prescription has been corrected, and then they present with cataract, to be able to get a rough idea of both the size and the shape of the lens, but also to be able to predict the refractive outcome. And can you explain to our listeners about what the Pentacam does there, talking about the spherical equivalent outcome and also maybe any surgically induced astigmatism?
When we deal with a patient with previous history of LASIK or radial keratotomies, we are dealing with a cornea where the anterior cornea surface has changed and the overall cornea refractive power is different. The Pentacam is a critical examination in order to calculate the IOL power for this patient in the preparation for cataract surgery for any type of lens implant. The advantage of the Pentacam is the measurement of the direct cornea refractive power and particularly the measurements of the posterior cornea surface. The Pentacam is an essential measurement when we are planning an IOL post-refractive surgery and obviously increases the reliability, the precision of the prediction of the lens implant to a great extent. The examination of post-refractive surgery patient is not limited to the lens calculation, but also offers the possibility of examining the cornea with a cornea densitometry, examining the flap. So I've seen many cases of patients presenting after an injury with a flap fold, with microstriae or with interface epithelial ingrowth needing intervention. And again, the Pentacam offers an examination of the anterior posterior surface, the flap, and the stromal layer. So we have the full assessment, not just the refractive power, but also the anatomical tomography image that helps the management of this kind of patients.
Time for a word from our sponsors, Mainline Instrument, leading in ophthalmic innovation since 1997. Mainline Instrument supplies premium ophthalmology equipment from global manufacturers, including eye care, Oculus, Tord Pi, Tomei, Optomed, Huvitz, and Neats. From advanced diagnostics to surgical solutions, explore their products and services or book your in-clinic demonstration at mainline.co.uk. Mainline Instruments. Unmatched service, unbeatable products, unrivaled quality.
If we could talk about the Pentacam and its importance in helping you choose IOL powers, especially premium IOLs, multifocal IOLs, or toric IOLs, how do you feel the Pentacam helps you there?
We have increasingly high expectations from patients, and also from a clinician point of view, we are aiming for always a higher level of precision in predicting the IOL power. The advantage of the Pentacam is the measurement not just of the anterior and posterior surface, but the total corneal refractive power of the eye. In addition to that, the Pentacam can also offer the aberrometry and the refraction. When we are preparing and examining a patient for a premium IOL, we want to examine not just the corneal refractive power, but the total aberrometry of the eye. So the Pentacam AXL Wave offers both platforms in order to assess the patient and measure the patient. There are critical measurements for this type of patients. One measurement is the pupil size in dim light and bright light. This is an essential measurement when we are planning multifocal lenses. Another measurement is the aberration of the eyes. So the Pentacam can guide the clinician and detect patients with higher order aberration, patients who are not suitable, not likely to do well after a multifocal lens implant, and can help a great deal in selecting the correct lens for the correct patient. So it becomes an essential tool to guarantee a successful outcome, and particularly satisfied patients, which are the most important part of our work.
And talk about the Pentacam range. You mentioned about the AXL. There are 2 or 3 different Pentacams. Which one do you have in your hospital?
So in the NHS department, we have the AXL Pentacam. In the past, they started off using the basic Pentacam many years ago. And outside the NHS, I've used the AXL Wave Pentacam for refractive assessment of patients. And obviously with the AXL and AXL Wave, we have the combination of the topography together with the aberrometry, refraction, and the retroillumination. Retroillumination is also a very important tool for postoperative assessment, for postoperative surprises, refractive surprises, to assess patients following an implantation of a toric lens, to assess the axis of the IOL, and also to guide the clinician in case we have to plan a realignment of the lens.
That's what I was going to say. Maybe you could just explain to our listeners a little bit more about retroillumination and its use maybe in toric IOLs.
So retroillumination is an extremely important function. So in the preoperative patient, retroillumination is assessed in order to assess the clarity of the ocular media and to assess the objective impact of corneal opacity, lens opacities, the type of corneal and lens opacities that have an impact on visual function. In the postoperative patient, the assessment of retroillumination is critical when we assess a toric IOL position. So the Pentacam will offer the refraction measurement and the retroillumination assessment to identify the precise axis of the IOL. Can also guide the clinician in a realignment of the IOL. So there is a software built in the Pentacam that can actually guide the clinician of how many degrees, in which direction the lens has to be realigned. So these are extremely important tools that make our life very easy. This type of calculations take long time, chair time, refraction with different tools. The advantage of the Pentacam is that in one diagnostic platform, we have many different types of assessment, and ultimately we save time to the patient, but also we make the life for surgical planning and the reliability of our surgical plan a lot higher.
And talking about refractive surgery, do you tend to use the Pentacam quite a lot in all of your pre-assessments and post-assessment?
Yes, the Pentacam has a critical role. So obviously for refractive surgery, a very important role in the screening of patients. So we want to screen patients with form fruus keratoconus, with abnormalities of the posterior cornea surface. So the Pentacam is an incredibly important tool in the first screening of patients. We also want to assess patients from the aberrometry point of view and from the refraction point of view. So for a refractive practice, this is an essential diagnostic stop, an essential test for the preoperative examination. And then postoperatively, the Pentacam is also used for examining the flap, examining the topography, examining the ocular surface. So it guides the clinician from the first time we see the patient through the door up to the final postoperative assessment. For many patients, is also a tool for monitoring long term. We see now patients who had refractive surgery 20, 25 years ago, and they present with symptoms of visual deterioration or change in refraction. So the Pentacam also comes into a very important role when we detect and examine a patient with post-LASIK ectasia, when we monitor them, and when we need to start planning treatment to correct and to prevent further progression of the problem.
So you're talking about the Pentacam having 5 diagnostic features. Which is the most important one for you, Dr. Pelosini?
Well, I think the tomography assessment is the most important because it helps the, obviously, for corneal evaluation, anterior posterior surface and pachymetry, but also for the anatomical examination of the anterior chamber. And together with the tomography examination, these two are the most important application. The aberrometry, the retroillumination, and the refractive platform are also very important too. So the multiple application of the Pentacam from a logistic point of view are very important because with one scan, we can examine the patient and evaluate many different structures. So it is important from the screening level to preoperative assessment to a postoperative stage.
And maybe you can explain to our listeners what the impact it's had with you in your day-to-day environment with your allied health practitioners, with your technicians, in comparison to maybe 2 years ago, 5 years ago, 10 years ago. The technological changes must make your day a little bit easier.
Absolutely, yeah. So when I first started up, we probably used the Pentacam as a topographer, and in the assessment of post-refractive patients preparing for cataract surgery. We then started to use the Pentacam for all the corneal abnormalities, the ectasia, the keratoconic. So in keratoconus, from a clinical side and also from the side of the optometrist fitting contact lenses, the Pentacam is an essential tool, is always in use. It is part of every single assessment of keratoconic patients, from presentation to treatment stage to monitoring annually post-cross-linking. The Pentacam is also very important in cornea transplant patients. So we are now using it more and more often to assess the cornea densitometry in patients with cornea dystrophy and to decide when is the correct time to intervene on the cornea and when is the correct time to intervene and do a combined surgery. So it's guiding us in surgical decisions. So this is a more recent evolution. The use of Pentacam for aberrometry, retroillumination, and refraction is more dedicated to a refractive practice and is obviously a more recent development with the Pentacam AXL wave, but equally very important.
And how important is it to have both the quantitative and qualitative information when explaining to the patient? I think patients love figures and they want to be able to reach that figure you aim for. Is it easy to use the figures as kind of, a destination point for your patients?
Yes, patients want to see figures, especially when we examine a patient with keratoconus monitoring and we show them progression or we show 2 or 3 serial scans. They want to know, they're quite intrigued by the colorful maps and all the numbers we have on the screen, and they want to know what relevance they have and what is the importance of each of them. It is very important to have this display for a patient that at first may appear very complicated, but when we actually describe what we're looking at, patients are very fascinated and interested, and they understand what we evaluate. And so they are part of clinical decisions with us. So it's much easier to consent them and explain why we decide to treat and do a cross-linking, or why now we are dealing with a very advanced keratoconus where we have passed the stage of cross-linking and the only solution is a lamella cornea transplant, or why we could improve the regularity of the cornea by implanting a collagen segment. So it makes our conversation much easier and much more direct and more understandable.
And one thing we were chatting about before the podcast too as well, you were mentioning about how patients love the technology, they love taking photographs, they can bring back and show their family. Can you explain to our listeners a little bit more about that, please?
When we examine an anatomical diagram, the tomography picture of the anterior segment or cornea diagram, and we explain it to patients, patients understand what we are talking about. And immediately for the first time, they feel happy, they feel relieved because they understand what problem they have. And they are asking us permission to take a screenshot to show to their families or to wives or mother and father to explain what they have, because they feel that now they are able to describe it to someone else. They have understood what the problem is and they feel more in control. This is extremely important for patients. If we make them part of what we discuss and the decisions we need to take, they feel that they are in control of what they're having and they are in control of their decisions for their health. So this is extremely important. It's educational for patients, it's educational for our technicians. Our nurses are much more interested. They spend afternoons and mornings taking pictures. And when we do teaching in a tertiary hospital department and we explain how we use the pictures to guide our clinical decisions, they brighten up. Their eyes are opening wide and they're suddenly understanding that it makes sense. So they're much more interested also in their day-to-day job. It's extremely important, not just for the patients, but also for people around us working with us all the time.
And in terms of irregular astigmatism, you were saying that you get quite a few referrals in from primary care. As a primary care practitioner, what levels of irregular astigmatism should be concerned about? What levels should be sending to you?
Opticians are worried when they notice high astigmatism in a young person. They always think about the possibility of ectasia or keratoconus. So they send the patient to us in order to do a topography evaluation to exclude keratoconus. The other important message is that opticians are very aware that they need to start correcting patients very early. This is important to prevent amblyopia. So from a population epidemiology point of view, it is very important to have optometrists aware of the importance of detecting high astigmatism early to prevent visual impairment in adults. So it is extremely important. We encourage them to refer children with high astigmatism, first to screen out the ones who may have an abnormality of the posterior cornea, but secondly also to reinforce the message to the mother, the father accompanying the child in clinic. We will show them the topography. Again, it's very important to show them the picture and say, look, can you see these two axes are extremely perpendicular? Your cornea is beautiful. Look at the map. It's a beautiful geometric shape. Your astigmatism is not a disease. This is normal. You just need glasses. You may need contact lenses. Maybe when you are older, you may want to have laser refractive surgery. But it's not a disease. As long as you wear your glasses, your vision will be fine. So it's extremely important to see them early.
Yeah, and that can be one of the very difficult things as optometrists, trying to get that refractive control, because sometimes with glasses, it doesn't tend to work, and sometimes with gas permeable lenses, it can tend to kind of work, and that's where we go into keratoconic contact lenses and higher order aberrations. And it must be fantastic to have the Pentacam to be able to measure those for you too as well.
Absolutely. We work very closely with the optometrist and they do contact lens clinics in the NHS as well as privately. The Pentacam is an essential tool also for contact lens specialists fitting gas permeable lenses, hybrid lenses, or special scleral lenses. And another application of the Pentacam is that actually there is a software to help contact lens practitioners to fit gas permeable lenses. Fitting gas permeable lenses is more an art than a very regular science, and it's all down to experience.
Intuition.
It is very intuitive. Having the guide of this software will definitely make the first fitting much easier for a contact lens practitioner. So that is another application. Our optometrists are very aware and they use the Pentacam regularly.
You've seen lots of cases, I'm sure, over the years. Are there any cases that stand out to you as being just a very, very popular case? Maybe it was a person who came in who felt that there was vision wouldn't be able to be improved. Maybe we kind of had lost hope. And through the Pentacam, you were able to kind of find out that surgery was an option, and you'd be able to calculate the correct IOL and see them smile and be happy afterwards. Do you have any relative happy stories you can think back on?
I feel very lucky that I see a high number of patients with different degrees of complexity, and we are in a privileged position that we can help patients and we can definitely make them happy. Many examples. So it's very rewarding when we treat patients. So keratochronic patients are aware of their visual limitation problems since early age, and now often we see them when they're adults. And some of them may have had a transplant in their youth when they were 20, 25 years of age. And when they reach the time of cataract surgery, some keratochronic patients with even post-PK, if they have a regular cornea surface, are suitable for toric contact lenses. It's a small niche, it's a small group, but it's extremely rewarding to be able to treat a keratochronic or post-PK regular topography patient with a toric lens, reduce their dependence on glasses for the first time in their life, or their dependence on glass-permeable contact lenses. So the tool of topography and tomography and the assessment we get with the Pentacam is very reliable to deal with these complex cases. I've seen patients, pseudophakic patients, post-graft, needing an add-on lens, an additional sulcus lens to correct residual high refractive error when they become intolerant to gas-permeable contact lenses in adult age. These are adults. Patients with pellucid marginal degeneration. These are adult patients. Very often they have the disease in one eye. They have one normal eye, one eye with the pellucid marginal degeneration. And they are patients who are experiencing a progressive deterioration in vision in one eye in adult life. Very difficult to correct. Optometrists cannot manage to correct pellucid marginal degeneration. Some of them may wear gas-permeable lenses or large lenses, but glasses correction for them is not an option. So again, having the tool of the Pentacam, we have a collection of cases where we have done wedge resection of the cornea, reduction of the astigmatism, and then at the time when they needed cataract surgery, correcting the residual astigmatic error with a toric lens, helped with the plan of the Pentacam, has been revolutionary for them. We've also had patients with keratoconus, with a very irregular cornea, approaching the stage of cataract surgery. Very difficult to perform a reliable biometry in these patients. Keratochronic corneas are irregular cornea with high astigmatism. Even at the stage of cataract surgery, we cannot correct them fully. Now, the Pentacam offers a very important diagnostic platform to be able to plan, for example, corneal segments, corneal inlays, collagen segment. So we have a tool where we can examine an irregular cornea, plan an intervention, design how we can implant segments to improve the regularity. And after that procedure, then we are dealing with a much more regular cornea where the biometry is much more reliable. We can actually then plan a PC IOL and achieve a significantly more helpful refractive outcome for this patient. So there are many occasions and many difficult situations, clinical situations where the Pentacam is critical for our decision-making process and planning of complex surgery.
Are there any particular patients that stand out that you were able to make a big difference to their life with Pentacam?
Yes, I think we are in a position where we help on a daily basis many patients, and we can really make a difference in their quality of life by improving their vision. So I remember very well the case of a lorry driver who presented with cataract, very high regular astigmatism since very early life, and one amblyopic eye, has always been wearing high prescription glasses. He managed to obviously have the license for driving a lorry. One eye was always slightly weaker than the other one, but dependency on glasses non-stop. He presented in his mid-60s with beginning of cataract, deterioration of vision, which was critical for his job. And the assessment of cataract showed that he had a regular astigmatism. One eye had a higher refractive error and therefore was a refractive amblyopia since childhood. But by planning a toric lens implant, first in the amblyopic eye and then in the better seeing eye, we have been able to make him glasses free for distance. So this patient was absolutely delighted. For the first time, was able to see without a heavy prescription on his face, was able to function again, return to his job, and made extremely, a good recovery with a fantastic visual outcome. So in everyday's clinical practice, sometimes we make a big difference by not particularly doing very complex surgery, but we make change the quality of life of a patient with a very targeted intervention. So the Pentacam was obviously an essential tool to assess this patient cornea reliably, to plan the correct toric lens, which was a very high toric prescription. And we made a huge difference to his life.
It sounds like the Pentacam is just the ideal instrument for you and your work and everything you do.
Very much so. From the cornea to the anterior chamber to lens surgery, we use it all the time.
So I'm sure when the technician is off, it can make a bit stressful day for you.
Well, everyone needs to be able to use all the diagnostic devices we have. I always say this to juniors, to technicians, to new nurses. We all need to be interchangeable on the clinic floor. We need to be familiar with all our devices. So anyone needs to need to be able to sit a patient at any device and carry on a diagnostic assessment.
Thank you very much, Dr. Pelosini.
Thank you very much for having me.